Good morning, students. Hope you are all safe and sound after this super cyclone. It's like a two-way glitch, having the cyclone and the corona together. We are really facing hard times. Your semesters have been postponed for this purpose. Hope you are reading your semester things. We have to start off with our head neck part, and today lecture is the easiest part of the head neck, but again a very important part because this comes as a short long question and also short notes very commonly. So today we are talking about lacrimal apparatus. So whenever we call apparatus, we know that we are talking of a part which is composed of many subparts. So this lacrimal apparatus is composed of, first is lacrimal gland, next we have the lacrimal canaliculi, next we have lacrimal sac, and the last we have nasolacrimal duct. So these are the four parts of which the lacrimal apparatus is made up of, that is lacrimal gland, lacrimal canaliculi, lacrimal sac and nasolacrimal duct. So first of all, we need to know that why is this lacrimal gland present? Really for tears when you are sad, or like when you are really emotionally very vulnerable, you are happy sometimes. Is it the only use of tears? No. That is an overwhelming use of tears. The primary use or the primary function of tears is to give nutrition to the eye. So we did the eyeball and the front part of the eyeball, which we can see in between the two lids. This is known as palpebral fissure. Now what we can see over here, this white part and the black part, this black part is known as cornea. Now this cornea is an avascular structure. The cornea is an avascular structure. So this cornea will need its nutrition, will need its oxygen. So where from it will get it? It will get it from the tear film that coats the outer surface. And this tear film is produced by the tear gland. So many of the people who are using, many of you are using contact lenses, sometimes they have this prolonged use, and after that when you open the lens or when you during a prolonged wear time, you experience severe itching, pain sometimes, and sometimes it may lead to diminution of vision due to xerosis of the cornea, which is known as keratosis. So xerosis meaning that loss of blood supply and oxygen. And why this happens? Because the tear film is not coming in contact with the cornea for a long time, not giving its proper nutrition to it. So prolonged use of this contact lenses are not really recommended because they don't allow the tear film to bathe the cornea. So the point is, the main function of the tear film is to bathe the cornea so that it gets its nutrition and oxygen supply. So we will take up this parts of the lacrimal apparatus one by one. First we will see lacrimal gland. What is the shape of the lacrimal gland? It is almond shaped. It is almond shaped. It is having two parts. One is orbital part, one is palpebral part. Where it is present? So, situation, present in the superolateral part of the roof of orbit. Superolateral part of the roof of the orbit. So, if we see, this is the orbit. So, lacrimal gland is somewhere present over here. Superolateral part. So, this orbit is made up of the bones. When you read orbit, you will be knowing that on the lateral side there is the zygomatic bone. So, on the medial side of the zygomatic bone, medial side of the zygomatic bone. So, we can see it from the complete anatomy app. It opens, let's see. So, the lacrimal gland is made up of two parts. It's an almond shaped gland having so now we can see, so you can see this is the orbit. This is the orbit. So lacrimal gland is present in the lateral part. This is the lateral part. So, if we just isolate, so this is the zygomatic bone. This is the zygomatic bone. The zygomatic bone is having a lacrimal fossa. Here we have the lacrimal fossa, from where the lacrimal gland is present. Okay, so this is the zygomatic bone. So, if we undo this, so you can see this is the frontal bone, this is the zygomatic bone. So, on the junction of these two, is having the lacrimal fossa, okay. So, we will now look at the orbital part. The orbital part is the larger one. I said it is present in the lateral part of the roof of the orbit, and it is almond shaped. This palpebral part it is present in the lateral part of the upper eyelid, and the orbital part and the palpebral part are continuous behind the levator palpebrae superioris. It is present, it is just continuous. The orbital part and the palpebral part are continuous behind the levator palpebrae superioris muscle. Okay? Now, we can, if we try to draw it, the entire lacrimal apparatus, it will kind of look like this, and this you have to draw. So this is how a this is the lacrimal gland, what I am drawing right now. This is it. So this is the orbit, right? And this is LPS, that is levator palpebrae superioris. So this is the orbital part. This is the palpebral part. So you can see the orbital part is larger than the palpebral part, and they are continuous around the posterior border of the LPS, and it is present laterally. And this is the conjunctival sac. This is the lacrimal canaliculi. This is the lacrimal sac, and this is the nasolacrimal duct. So this is the entire lacrimal apparatus, right? So if we see this lacrimal gland, which is having two parts, so this is having lacrimal ducts, 12 in number, almost 4 to 5 from the orbital part and 6 to 8 from the palpebral part. 6 to 8 from the palpebral part. And all these ducts will open into the conjunctival sac. It will open into the conjunctival sac. In the superior conjunctival fornix, it will open into the superior conjunctival fornix. And then actually, so if we remove this palpebral part, which is having the maximum number of ducts, it is almost equivalent to removing the entire gland. So if we remove the palpebral part, it is almost equivalent to removing the entire gland. There are some accessory lacrimal glands present in the upper eyelid. Okay, so here we have the lacrimal ducts, 4 to 5 orbital part, 6 to 8 palpebral part, all of this in the conjunctival fornix or the conjunctival sac, superior one, and these ducts will drain into this part, palpebral part, and palpebral part will ultimately drain into the conjunctival fornix. So removal of the palpebral part amounts to removal of the entire gland almost, though it is just 1/3 of the lacrimal gland. But if we remove the entire lacrimal gland, is it going to stop tear formation? No, because there are accessory lacrimal gland. There are accessory lacrimal gland. Next, we come to the structure. So we have already read the glands. So it is a tubulo-alveolar gland. This much you remember. It is a tubulo-alveolar gland. It is a tubulo-alveolar gland. Now you can see that this is the lacrimal gland. It is pouring its tear into the conjunctival sac, and then this tear will come through this lacrimal canaliculi to the lacrimal sac. Now we have to know what are the factors which are, so before we go to the factors, we will see the lacrimal canaliculi. So these are the lacrimal canaliculi, and they are, as you can see, they are bent at acute angles. They are bent at acute angles. So lacrimal canaliculi will start from the conjunctival sac. They are 10 millimeter in length. Each canaliculi begins at lacrimal punctum. So if we see here, there is a swelling. This is known as lacrimal punctum, and then they are bent. Then you can see they are bent at acute angles. And they ultimately drain into lacrimal sac, and each lacrimal canaliculi, they present a dilatation which is known as ampulla. Okay, this is known as lacrimal canaliculi. Now we can see it is lined by stratified squamous epithelium. Next we come to the lacrimal sac. What is lacrimal sac? This dilated thing is the lacrimal sac, where the lacrimal canaliculi are opening. Where is lacrimal sac present? Lacrimal sac is the dilated blind proximal end of the nasolacrimal duct. It is present where? It is present in the lacrimal fossa. So let's see the lacrimal fossa once. So if we see this one is the frontal bone, this one is the lacrimal bone, and this one is the maxilla. So this is the lacrimal, this is the maxilla. So at their junction we have the lacrimal fossa, where the lacrimal sac is placed. So as you can see, the lacrimal gland is placed in the lacrimal gland is placed laterally, and lacrimal sac is placed medially. Lacrimal sac is placed medially. This is the lacrimal bone, this is the maxilla, this is the frontal process of maxilla, and at the junction of the two, it forms the lacrimal fossa. It forms the lacrimal fossa. So it is placed in the lacrimal fossa. So this is the one which receives the tear fluid from the lacrimal canaliculi. So this is one, right? Okay. So first we will find the relation. Now relation, if you see the picture, it will be easier for you. As of now, I won't go into the relation of the lacrimal sac because you don't know anything what is placed in the orbit and stuff. So it's no point telling you the relation. Once we are completing the orbit, we will come back to the relation of the lacrimal sac. Next we go to the nasolacrimal duct. So it is the distal continuation of the lacrimal sac. This is the nasolacrimal duct. So this is the distal continuation of the lacrimal sac. It is a membranous duct that opens into the inferior meatus of the nose. It opens into the inferior meatus of the nose. What is inferior meatus of the nose? Now if we draw it. So this is the which wall of the nose? This is the lateral wall of the nose. Here, this one. This is the lateral wall of the nose. Now this lateral wall of the nose is characterized by 3 shelf-like things which are known as concha. And these 3 shelf-like things dividing the entire lateral wall of the nose into 4 compartments which are known as meatus. So this is the inferior meatus, this is the middle meatus, this is the superior meatus, this is the supreme meatus. So the nasolacrimal duct is actually opening into the inferior meatus of the nose. We call it naket jole, chokhet jole. So the chokhet jole is actually coming to nak and it's coming out as naket jole. So this is how it is like the drainage of the tear. The tear fluid is ultimately coming out of the nose. That is the nasolacrimal duct. And the nasolacrimal duct is guarded, this opening, the nasolacrimal duct, the lower part is guarded by a valve known as the valve of Hasner. There is a valve, I've drawn it, this one. This is known as valve of Hasner. So if we see the nasolacrimal duct comes as a short note. So the nasolacrimal duct, we have to know the structure. So structure from outside inwards. From outside inwards. First of all, we have a fibroelastic coat, which is surrounded by a plexus of veins. And next we have the mucous membrane, and the lining epithelium is columnar epithelium, might be striated and ciliated. Not everywhere, but at times. Okay. So development, again, I am not going in details. I am not telling you where from it develops, but we will come to it when we complete the development. So this is the parts of the lacrimal apparatus and how the tear is going to get formed in the lacrimal gland come to the conjunctival sac in the superior conjunctival fornix, get drained by the lacrimal canaliculi to the lacrimal sac, and then passes to the inferior meatus of the nose via nasolacrimal duct. Now, if we see the picture, we will be seeing that the lacrimal gland is here, correct? And the sac is here. So the tear fluid is coming from the lateral part to the medial part. So what are the factors which are helping this drainage of the tear fluid? So factors helping the drainage of the tear fluid. So factors helping drainage of tear fluid. Number 1, the capillary action of the thin tear fluid film. It's very thin, so it has a capillary action. Number 2, the blinking movements of the eye. The blinking movement is done by the palpebral part of the levator palpebrae superioris, and what happens, the two parts of the gland is continuous by the posterior border of the LPS. So when the LPS contracts much, it causes a squeezing action on the lacrimal gland. Number 3, is the inward turning of the lacrimal punctum, which helps in aspiration of the fluid. So if we see this, there is lacrimal punctum which is actually directed inwards. So it aspirates the tear fluid into it. It aspirates the tear fluid. So the inward turning of the lacrimal punctum. And again you can see such a big sac, so there is a vacuum pressure effect. The vacuum pressure effect. What is the arterial supply? The arterial supply is lacrimal branch of ophthalmic artery. And what is the nerve supply? It is the lacrimal nerve. So this is all about your lacrimal apparatus. The lacrimal apparatus comes as a short long question. Nasolacrimal duct itself comes as a short note. If NLD comes as a 3-mark short note, you have to write its course, you have to write its histology and where from it starts, where does it end, how does it look like, and of course you cannot miss the development, which is not covered into this lecture because your development has not yet started. As you start off with development, we'll come back to it. Thank you.